Hello everyone, Teresa Van Leeshout here. Just checking my equipment. And today is the day before the federal election 2025. It's the 2nd of May. I'm going to talk about chapter 5 of my excellent book, my brilliant book, Political Persecution of Women and Children World, 556 pages of research evidence and real life evidence affecting the world's women and children. If I have a problem with this broadcast, the connection or anything like that, then I'll finish it tomorrow, Saturday. So tomorrow's the federal election in Australia, and I'm doing chapter 5 of my book as evidence and testimony against criminal and corrupt politicians, talking about a very serious and difficult issue. The way that politicians have used the practice of psychiatry to kill millions of people globally since 1808. And I've proved in my book, chapter 5, that it's a very, very big problem all over the world. And especially in Australia, it's actually very bad for this. Now, this might be a very difficult video to watch for some people, but I will ask you to watch it to the end. It's a difficult topic and issue to talk about. And there are many, many reasons why it's difficult to talk about and even confront and listen to, because there are many people in society who are guilty of also killing their own relatives with this violent psychiatric practice since 1808 globally. I'm also going to talk about how the politicians have killed people with the COVID injection as well, and euthanasia injections. So the killing of humans by politicians and their paid workers all over the world and in Australia has been a big problem, particularly since the 1920s. Since the 1920s, the pharmaceutical industry is just killed millions of people, and their directors make billions and billions of dollars globally from killing people with these very, very dangerous drugs. And you know, the word pharmaceutical comes from the Greek word pharmakia, which is Greek for poison. So that's what it is when they're pumping these pharmaceuticals into humans, and they do it by force in many, many countries and under the law as well. And to inject humans with a pharmaceutical drug by force is just attempted murder. So the charges that are criminal charges, it's very criminal and violent what they've been doing for since the 1920s. And the criminal charges that should be brought against most of the politicians of Australia and all over the world, especially Western nations, they're very, very bad for this. The criminal charges that are brought against them should be 5 main criminal charges, which is assault, torture, attempted murder, and stealing. And I'll explain that all. I have explained, I've already proved it in my book already, chapter 5. I'm going to read a significant amount of evidence from it about how they've been killing people with this horrible, violent, disgusting psychiatric practice since 1808. It started in Germany, that's where the practice started in 1808, and they've been killing people in Australia since 1811. That was the first building that they created for the purpose. It's very, very criminal. I've been campaigning for over 10 years to have it abolished. There's reports, government reports, which I wrote about extensively in my book. This one was published in 2017 by the Australian Bureau of Statistics, and it's a death report of 75,858 dead Australians in this report, all under the practice of psychiatric drugs and pharmaceutical drugs, what they call prescription drugs. So, look, what I'm going to do is probably just read from my book, okay? I've done a lot of the hard work already. A lot of people don't want to know about this because a lot of people are guilty. There's men in society who've killed their wives with this practice. There are women who have killed their relatives and men who have killed their relatives, neighbours, people they don't like politically or sociologically. After I go through all the evidence, I'm also going to prove to you that the subjective, horrible, defamatory labels of mental illness and other subjective labels is all fake and false. So not only have they been killing people, they basically, what they do is defame people to kill people. That's what they've done since 1808. I proved it in my book without a doubt. It can go before any judge in Australia, no problem. And the judges will definitely side with me as a teacher for 30 years. The judges will side with me, and the practice should be abolished, because once the judges read this book and all the politicians read this book about the evidence, they should practice. They should abolish the practice of psychiatry, and they should jail most of the psychiatrists as well for those 5 charges, and plus the politicians are guilty. Anyway, lots and lots of problems with this issue, lots of problems, and I'm just going to read through some of the evidence. It's not even all the evidence. I could probably write 5 books on this topic and prove without a doubt that it's just totally violent and criminal what they've been doing. If you want to have a masterful lesson in this horrific practice, then you should watch this entire video and listen very, very carefully to all the evidence. Okay, now it's chapter 5 of my book, and I'm doing this purposely, reading this out the day before the election as evidence against the politicians and their paid workers. Chapter 5 is called The Holocaust Nature of Psychiatric Drugs, Practices, Laws and History World. 105 pages of evidence. And you know what, before I read evidence from chapter 5, what I'm going to do is I'm going to just tell you my views on the law, the political law, because how they use the law, public workers, public money to do this killing machine, what I call a killing machine. And you'll understand how it's a killing machine for over 200 years, 2 centuries. But first I'll talk about my views on the political law and also the COVID injection as well. I'm going to give you some evidence and statistics that I put in my book for COVID, the COVID injection. As I said, they also kill people with the euthanasia injections. Euthanasia is state-sanctioned murder. That's what euthanasia is. So this is how the politicians use the law of death policies and practices, and it really just makes them not much better than Hitler. Here are my views on the political law. The law is a set of rules made up and enforced mostly by political government men imposed on the population, often violently. I didn't vote for those politicians. I don't like them for very good reasons. No one has to follow their vicious laws. What they do is power, slavery, control, money, violence, destruction of society. Most laws are bad, not good. Laws created by men forced on women are not valid. I know about rules. I created and used them as a teacher in the classroom for 20 years. Very simple, positively imposed rules to effectively teach and manage a group. Rules are a guide. The law is supposed to be a guide to assist, positively, effectively guide a nation, not ruthlessly enforced. Any laws that don't positively benefit society in any way are bad and deserve to be ignored and removed. The law is also supposed to be used to punish murderers, rapists, drug traffickers, sex traffickers, etc., serious violent criminals, 95% of whom are men. Most politicians and police don't do that effectively. To obey evil people is to be a slave. I don't have to follow their evil bullshit made-up laws, neither do billions of other good people in this world, particularly women. It would be better to have similar to the 10 Commandments as the basis of the political law, or certainly teachings in the New Testament. Very basic laws to punish serious violence and laws to promote positive activities, behaviours, education, work, business, etc. Yet for most politicians, it's about power, control, and money, not justice and freedom. So a lot of people say the law this, the law that, it's not lawful, but they're using the law to harm the population, and they do that all over the world, the political law. You see, what's the teachings of the New Testament and the political law, they're very, very, very different. Okay, Now, I'm going to just read out a bit about the COVID injection and the lockdowns that they forced. I wrote extensively about the COVID lockdowns and injection in my book, but I'm just going to read a little bit out of what I published, because it's to do with the killing of people with the pharmaceutical injection. As I said, pharmaceutical, the word pharmaceutical comes from the Greek word pharmakia, which means poison. Okay, let's just look. I wrote a little bit about a Christian lady in South Australia who was put in prison from a church group for wearing a mask and refusing to wear a mask at church and to do the QR code. She's a friend of mine. She was locked up in a jail in South Australia without trial for 42 days for refusing to do the QR code and wearing a mask at church. Now, that shocked the hell out of me when that happened. I met her there. Okay, so what I've written from that. This is outrageous. Churchmen very stupidly and corruptly called policemen and their Nazi magistrate locked her up without trial. This is the sort of disgusting thing that goes on by some corrupt so-called church men and atheist politicians, police and magistrates. Later, when let her out and drop the charges later on, it's the politicians, police, magistrates, other government workers who have acted genocidal factors towards Aboriginals for 235 years. Now the rest of us are suffering. COVID and lockdowns are a big scam based on lies and fraud to oppress and imprison society worldwide. The word coronavirus has over 13,240 world, European and USA patents dating from 1984 to 2020. And COVID-19 has over 200 patents from 2015 to early 2021. Everything to do with coronavirus and COVID-19 is patented, proving it's man-made fake, including the so-called virus itself. COVID injections, testing, tracking, tracing, social distancing, all the equipment, everything propaganda related to it is patented. This evidence and other evidence proving the fraud I presented on my BitChute channel, Teresa Van Leeshout, Operation COVID-19 2015 to 2020 Societal Prison System World. I also published very early on lots of videos on YouTube and Facebook very early on in the scandemic, and they kept taking them off social media all the time with censorship. You know, if you look at censorship laws throughout the world now, it's getting worse and worse in Western countries where there's just more and more laws to stop people exercising free speech and presenting evidence. In 2024, resigned in 2022, USA NIAID Director Anthony Fauci testified to some degree aspects of COVID was based on lies and fraud. He refused to take any blame and responsibility. I have a USA Medical Encyclopedia published in 1989 proving the word coronavirus means common cold. Also, WITS, the World Integrated Trade Solution, published COVID-19 test kits global distribution from as early as 2017. So they distributed the global test kits globally 3 years before they announced their scandemic. Many people have poured Coca-Cola, all other soft drinks, energy drinks, Red Bull, cordial, milk, alcohol, vodka, whiskey, brandy, commercially bottled and carbonated mineral water on COVID rapid tests. They come up positive. Such dodgy, fraudulent tests. There's also medical research admitting these facts. October 2021, how to abuse a COVID-19 antigen rapid test with soft drinks. ncbi.nlmnih.gov. Everything in my book published is researched and sourced. YouTube and Facebook keeps my excellent teaching and research evidence up for a while, but then removes most of it. The corporate media won't publish my research even though they know who I am. Censorship kills people. This is what the world's politicians and their government workers want. I don't have a huge social media following, yet Nazi political government men here over the past 10 years have wasted millions of dollars targeting and harming me purely on political issues. In fact, I work out it's something about $50 million that they've wasted across this country over the past 12 years trying to harm me and rub me out pretty much. All this time I've done absolutely nothing morally wrong. Morally, I'm 100% innocent. Worldwide, 38 countries in a study claim COVID death rates are 0.0003%. 0 to 19 years old, 0.002%, this is the death rates, that's 20 to 29 years old, 0.011%, 30 to 39 years old, 0.035%, 40 to 49 years old, 0.123%, 50 to 59 years, 0.506%, 60 to 69 years, 0.025 to 0.032%, 0 to 59 years, that's the average, and 0.063% to 0.082%, age 0 to 69 years old. That's from source PMC, PubMed, Central National Library of Medicine, National Centre for Biotechnology Information, USA, age stratified infection fertility rate of COVID-19 in the population, ncbi.nlm.nih.gov. Given such extremely low death rates, there was absolutely no valid reason whatsoever to lock down, imprison the world's population and inject a synthetic chemical compound pharmaceutical drug into the world's population. An injection that has now proven to kill and or maim millions worldwide, according to many researchers and professionals. After politicians and globalists administered COVID-19 injections from roughly December 2020, excess deaths accumulated in every nation on earth. Source of that is ourworldindata.org. Have a look at that website, ourworldindata.org. Graphs in every nation prove an increased trajectory in deaths and excess deaths over the 2+ year period from start to COVID injections, from the start of the COVID injections. Logically, if the injection was working, the deaths and excess deaths would significantly decrease, but they didn't. They continued to rise. Clearly, this is a crime against humanity on a global scale. Research and view excess deaths, cumulative deaths from all causes, estimated cumulative excess deaths during COVID, world multiple country view. That's ourworldindata.org. The Australian Bureau of Statistics, ABS, also published excess deaths in the year 2021 of 5,090 deaths, the year 2022 of 25,235 deaths, and year 2023 of 6,220 deaths. So that's just the 3 years of deaths in the COVID injection period of that period. That's from 2021 to 2023. All right, now what I put that in here for this video for the killing of politicians with the psychiatric practice is because the world got an experience in that period, 2020, from 2021 to now. The world has had some experience of the pharmaceutical killing that's gone on actually under the psychiatric system since the 1920s with the pharmaceutical injection, but they've been killing people with that practice since 1808. And in fact, they killed people with that practice before that as well. It was the oldest building that I found is 7 centuries old, and that's in the United Kingdom. 7 centuries they've been killing people with that psychiatric practice. And also, before the practice of psychiatry was created in 1808 in Germany, they were called alienists. That's what they called them, and their victims were called aliens. And they were murdering people with the practice, similar type of practice before that. Even through the Middle Ages, in various parts of the world, they were killing people for the subjective labels that they give people. And I'm going to go through a lot of those labels to prove that's all fake and bullshit. They just use horrible defamatory character assassination words to kill people with their violent practices and drugs. And I go through in chapter 5 the whole history of some of these violent, disgusting, horrific practices that this practice psychiatry have used. Now, that's not to say, I would say 99% of psychiatrists, because there's not 1% maybe who, well, they probably kill people. You'd have to ask them all, have you killed people with your drugs in practices? And there's probably a few that, you know, have left or had their registration cancelled because they worked out, or, you know, resigned or had their registration cancelled because they worked out that their practice is very, very toxic. And I've quoted actually a lot of psychiatrists in my book too, in chapter 5. You know, I've quoted professors, doctors, lawyers, history teachers, history professors, all sorts of teachers, lawyers, psychologists, psychiatrists, politicians, historians, academics, all sorts of people I've quoted in this chapter 5, and plus, you know, government reports, public reports, media reports, testimonies of dead and living people, victims. So, you know, it's a big, big problem. Okay, so the world with the COVID injection and lockdown, they've got a bit of an experience. I'll say that you got a bit of an experience of what has actually been going on for over 2 centuries, for over 230 years with this practice. So I've started it by saying, as I said, it's called the Chapter 5, The Holocaust Nature of Psychiatric Drugs, Practices, Laws and History, World. Those who make you believe absurdities can make you commit atrocities. That's from Voltaire, 1765. It's one of the quotes on the back of my book. If you want to get the book, you can just email me or phone me or text me or private message me on social media, and I can post it to you for the cost of the book. Nowhere is Voltaire's statement more true than with the politicians' use of psychiatry worldwide for more than 230 years. Psychiatry is political, sociological, not medical. It's not biological. It's 100% subjective defamation. It's a nasty, abusive, dangerous practice. Politicians and their paid workers use it to destroy and terrorise populations, for control, power, to remove and eradicate people they consider inferior or don't like politically or sociologically. It's eugenics in its purest form. It's also depopulation. It's a violent, slavery, lethal killing machine for centuries worldwide. It's a massive problem and it needs abolishing. And I quoted, I'll go through later, I quoted an American USA medical publication from 2015. It's in Georgia, and they admitted that politicians, or they didn't say this, but they admitted that roughly 8 million people die under this practice globally. So what that means is that the politicians and their psychiatrists and the judges and the police and the public trust and the public advocate and everyone who enforces it, they're pretty much killing 8 million people a year globally, which I think was about 14.7% of the deaths. The global deaths globally. Australia is actually very bad for this practice, and they kill a lot of people in Australia with it. As Australian Bureau of Statistics report, 75,858 dead Australians in that report in a 13.5-month period, only 13.5-month period. It's the only report ever produced of its kind in Australia. It's produced by the Australian Bureau of Statistics, so they would have got all the death data from the government computer system. And that means if they produced a report for the past 50 years in Australia of the deaths, that's a 13.5-month period, 75,858 dead Australians. It was 49.4% of the total deaths in that period. So if they produced an annual report every year for the past 50 years, it would be just probably nearly 1 million Australians. They've killed about 1 million Australians with this practice since 1811. That was the first building that they built for the purpose. As I said, violent slavery, lethal killing machine. Now, I'm just going to describe to you under the law how politicians put this in the law, this practice, and what it actually really is in reality. Imagine you have a well-paid job where you wake up daily to destroy people's lives. You can tell as many lies as you want about people. You can defame and character assassinate people. You can use the police and other workers to assault, threaten, lock people up. You can prevent people leaving a building. You can lock up, assault, threaten, torture and release anyone on your instruction anytime you want for decades until they are dead. You can use security and other staff to violently restrain and hold people down while you subject them to violent practices and dangerous drugs. You can inject people with dangerous chemical substances knowing or not knowing what's in it. You can destroy people's health, maim, make people disabled. You can assault, torture and inject people with dangerous drugs in their own home. You can make people a prisoner in their own home because you know that if they move to another address, you're going to find out you're going to inject them there as well. You could steal people's assets, wealth, houses, money, control and deplete their bank accounts. That's what they do through the public trust. It should be abolished. And billions of dollars, they start like Hitler did, killing his victims and stealing all his wealth, all their wealth. And that needs to be returned to the victims, and they need to unlock the control of the bank accounts. All the banking directors are all to blame for this as well. All the SAT judges, all the public trust managers, public advocate, and they're all guilty of these Holocaust scandals. All the Holocaust scams. You can say whatever you want to and about people with no proof, no evidence, and people will believe you. You can turn people against their own relatives, friends, neighbours. You can destroy families. Other people can use you to destroy lives. You can fabricate and destroy documents. You can instruct people to control other people's lives, everything they do. You can say and do anything you want to people using judges, police, lawyers, nurses, security guards, pharmaceutical companies, guardians, banks. You can assault, torture, steal people's children. You can sexually assault, rape people and allow others to do it with impunity. You can kill people, including children, with 100% impunity because they put it in the law. You can censor people. You can do all this because politicians allow you to do it. They created laws, paid workers and used public money to do it. And you can do all this to anyone and everyone in an entire nation. Your job name is a horrible fake name, psychiatrist. Does society really want people to be able to do this to others for such a job to exist and be legal? I think not. At this point, I will mention also that in Australia, 85% of psychiatric drugs are given by general practitioners, which is a frightening percentage. But what they do is it's all enforced through the psychiatric law. They call them mental health acts, but that's not the correct term. It should be psychiatric law. And I proved in my book that there's no such thing as mental health, and mental illness is completely fake. That it's actually to do with the brain, and it should be called, if anything, brain health. But what they do is they kill the brain. They kill the brain with their violent practices and their dangerous drugs. So the whole thing is just a scam and a fraud and disgusting. Let's look at some of their dangerous drugs. The word pharmaceutical derives from the Greek words pharmakietikos, or pharmakia, or pharmakon, pharmakias, which means poison, sorcery, scapegoat, witchcraft, preparer of drugs, poisoner. Big Pharma are the biggest drug pushers, dealers, traffickers and drug criminals on the planet. Generally speaking, psychiatric drugs are classified into 9 categories: antipsychotics, antidepressants, and anxiolytics, and anti-anxiety drugs, psychostimulants and stimulants, mood stabilizers, central nervous system depressants, induced sleep coma, tranquilizers, sedatives, substance abuse drugs, more drugs, which is more drugs for people already on drugs, cognitive enhancers, off-label and generic drugs. They lie about their drugs. They lie about everything, actually. I'll go through more of that later. They lie about their drugs. For instance, there's no such thing as an anti-psychiatric drug because there's no improvement in the person's health. Other lies about their drugs: they're not medication, they kill people. Psych drugs also can be highly addictive, turning people into drug addicts. All their drugs are unnatural, laboratory-made, synthetic, toxic chemical compounds. They kill the brain, they kill the heart, other organs, the respiratory system, the nervous system, the body, especially high doses and long-term use. The FDA, which is the Food and Drug Administration in the United States, and the TGA, the Therapeutic Goods Association in Australia, phone call coming on. And the TGA, Therapeutic Goods Association Australia, and other research published that psychiatric drugs cause the following: agranulocytosis, abdominal pain, angina, which is sudden acute pain, and anorexia, abnormal bleeding, bruising, addiction, agitation, restlessness, anxiety, akathisia, which is severe restlessness, rocking and shaking, altered mood, black tongue, diminished taste buds, breast enlargement in men and women, breast milk production, black and tarry stools, blood in stools, bloody vomit, burning and tingling in the hands, arms, feet, legs, blisters and rash, blood disorders, blood clots, blood sugar, blackouts, birth defects in pregnant women, brain shrinkage, breathing problems, cardiac arrhythmia, chemical castration, cold, clammy skin, confusion, constipation, crushing chest pain, coma, cardiomyopathy, coughing, chest pain, cardiac arrest, diarrhea, difficult, frequent, painful urination, dark-coloured urine, difficulty, damage breathing and swallowing, damage to blood pressure and pulse variations, difficulty concentrating, dizziness, faintness, drowsiness, damage to appetite and weight, damage to sex drive, ability, function and impotence, damage to vision, blurred vision, damages teeth, it rots teeth, dry mouth taste, delirium, difficulty thinking and concentrating, death, delusions, depression, difficulty falling asleep and staying asleep, insomnia, death from liver failure, diabetes, hypoglycemia, emotional numbing, enlarged pupils, epileptic seizures and death, eye sensitivity, pain, redness, discolouring, excessive sweating, excessive excitement, anxiety, extreme restlessness, fainting, fast, irregular pounding heartbeat, flu-like symptoms, fever, chills, sore throat and other signs of infection, frequent, painful, difficult urination, lost bladder control, fatal blood clots, gas bloating, headaches, migraines, heart failure, heart palpitation, heat stroke, hemorrhaging, high fever, hives, hair loss, hoarseness, hot flashes, flushing, hypomania, abnormal excitement, hypersensitivity, hallucinations, increased irritability, increased violence and hostility, increased risk of homicide, increased infertility, involuntary tics, twitching, itching, increased appetite, increased sweating, increased sadness, crying, increased weakness, tiredness, lethargy, indigestion, internal bleeding, jaw, neck and back muscle spasms, loss of appetite, lump or tightness in the throat, low blood pressure, liver damage, lowered white blood cell count with risks of infection, muscle pain and weakness, muscle twitching, jerking and stiffness, mania and manic reactions, myocarditis, memory lapses, loss, impairment, amnesia, miscarriage, muscle weakness, tightness, muscle and joint pain, spasms, neck stiffness or soreness, nervousness, nightmares, nausea, vomiting, numbness, burning, tingling in hands, feet, arms, legs, neuroleptic malignant syndrome, psychosis, psychotic episode, purple blotches under the skin, bruising, tissue damage, pain in the back, muscles, joints, other body parts, pain in upper right side of the stomach, painful erections, painful irregular menstruation, pancreatitis, panic feelings, attacks, paranoia, rash, PSSD, blisters, dry and discoloured skin, ringing in the ears, reduced brain volume in multiple areas, respiratory breathing failure, difficulty, slow, shallow, ineffective, fast breathing, sedation, extreme sedation, seizures, convulsions, sexual dysfunction, slow, slurred, difficult speech, sterilisation, stomach pain, cramps, indigestion, stuffed runny nose, stunted growth, small purple skin spots, sore throat, fever, chills, other signs of infection, sudden muscle twitching, uncontrolled jerking, sudden upset, stomach pain, suicidal thoughts and behaviour, suicide, swelling inside the nose, swelling of the eyes, face, lips, tongue, throat, swelling of hands, arms, feet, ankles, lower legs, swelling, itching, burning, infection in the vagina, tightness in the throat, hands, feet, chest, twitching, shaking, shuffle walk, distorted gait, toxic psychosis, tachycardia, which is a heart irregularity, tardive dyskinesia, which is a serious movement disorder, unusual bleeding, bruising, vomiting, dark matter, weakness, numbness of arms and legs, severe weight gain and loss, yellowing of the skin or eyes, jaundice. I'm sure there's more. Would you willingly take psychiatric drugs knowing they can cause that? Most psychiatric drugs have black box warnings, including warnings of fatal, life-threatening, permanently disabling effects. They're all direct effects. Pharmaceutical companies lie to the public claiming they're side effects. They're not, they're direct effects. That's because they're killing people with these drugs. You won't find any published medical literature anywhere in the world stating a list of positive medical health benefits or effects of any psychiatric drugs. That's because there aren't any. Would you willingly take drugs they admit can kill you or cause suicide? No, you wouldn't. If you don't willingly take their dangerous drugs, they violently inject you. It's the very definitive of assault, torture, and attempted murder. Quoted many professional people. Dr. Peter Bregan, MD, is a USA Harvard University trained psychiatrist based in New York and former consultant at NIMH. He has many public video presentations, dozens of scientific articles, more than 20 published books, including Toxic Psychiatry and others. Dr. Bregan, what should we really call psychiatric drugs? 17th of January 2018. Quote, Dr. Bregan, psychiatric drugs are neurotoxins. A toxin is any substance poisonous to an organism. A neurotoxin is a substance that alters the structure or function of the nervous system. Neurotoxin is a poisonous substance that acts on the nervous system and disrupts the normal function of nerve cells. Medically, a neurotoxin is any toxin that acts specifically on nervous tissue. There is no rational way to argue against putting psychiatric chemicals into the category of neurotoxins. All psychiatric substances alter the structure or functions of the nervous system and disrupt the normal function of nerve cells. All of them act specifically on nervous tissue. Drug companies tailor their future products to disrupt and alter the brain functions of normal animals before they begin to test them on humans. When a potential psychiatric drug fails to alter, disrupt, or impair normal function in the mammal brain, the drug companies discard it as useless for a psychiatric treatment. Prozac, for example, resulted from an intense search for a chemical that would disrupt the normal functioning of serotonin neurotransmission in the animal and human brain. Similarly, it is not a coincidence that all antipsychotic drugs disrupt dopamine neurotransmission in the animal and human brain. The biochemical aim of all psychiatric drugs is disruption of normal neurotransmission in the brain. The first great psychiatric researchers, Delay and Denneker, knew this and openly discussed the neurotoxic effects of the drugs that started the revolution in the 1950s psychiatry, including thorazine, also known as chlorpromazine, and haldol, also known as haloperidol. These shocking, that's Dr. Bregan done, and I said, these shocking admissions are 100% criminal. What psych drug companies directors do with their drugs, experimenting on humans, animals, and on the brain, and the deaths enforced under psychiatric practice, general practitioners and other government staff, it all deserves to be shut down and abolished. Another article mentioned from the mentalhealthforum.net, 5th of November 2015. Psychiatric drugs kill 500,000 Western adults annually. Few positive benefits. Leading scientist, this is Dr. Peter Gosch, he's a professor. Him quoted, psychiatric drugs cause the deaths of over 500,000 people aged 65 years and over every year in Western nations, a Danish scientist says. He warns the benefits of these drugs are minimal and vastly overstated. Research Director at Denmark's Nordic Cochrane Centre, Professor Peter Gotch, says the use of most antidepressant and dementia drugs could be halted without inflicting harm on patients. The Danish scientist's views were published in the British Medical Journal. His scathing analysis will likely prove controversial among traditional medics. However, concern is mounting among doctors and scientists worldwide that psychiatric drugs are doing more harm than good. He's just being nice. In particular, they say antipsychotic drugs have been overprescribed to many dementia patients in a bid to calm agitated behaviour. Gosh warns psychiatric drugs kill patients year in and year out and holds few positive benefits. He says in excess of 500,000 citizens across the Western world aged 65 years and over die every year as a result of taking these drugs. That's from Dr. Peter Gosh, 2015 Reuters, The Guardian, and also bmj.com and mentalhealthforum.net. Dr. Peter Gosh is also a clinical trials expert. In Australia, 84.7% of psychiatric drugs are prescribed by general practitioners, which is a massive problem, 14.3% by psychiatric staff. But it's the psych laws, practices, drugs, staff, GPs, politicians, police, judges, collectively, that are the major problem. More on this as we go along. And then Peter Gosh, another one from here, Dr. Peter Gosh, or Professor Peter Gosh, 11th of August 2016. Prescription drugs are the third leading cause of death. Professor Gosh said prescription drugs are the third leading cause of death. There are several studies that show about the same. Some people say it's the fourth leading cause of death. It doesn't matter. We kill a lot of people with our drugs. I describe why in this book I published called Deadly Medicines and Organised Crime, how Big Pharma has corrupted healthcare. So we have created a society that looks like the man at the bottom, all about drugs. It is really an epidemic. 8 million daily doses in Denmark, and we are 5.5 million, so everybody can get more than one drug every day from they're born until they die. But of course some get more drugs than others, and 1 out of 8 get at least 5 drugs every day. And these people are mostly the elderly who tolerate drugs most poorly. That doesn't make any sense. Just to take one of them, arthritis drugs. 1 of 8 Danes gets one every year, and they are highly lethal. When I worked in the drug industry many years ago, I did research on naproxen, and one day I read the packet censored, and I said, my goodness, the drug that can kill me in so many ways, different ways, I will never take it for the rest of my life, any anti-arthritis drug. And I haven't done that. So these drugs are used for virtually everything. Back pain, knee pain, migraine, whatever you can think of. It's absolutely insane. Now, the companies cheated with their data. Merck, as you know, concealed cases of myocardial infarction and even death with rofecoxib. That's the drug. Rofecoxib. They always have these stupid, convoluted names as well for all these stupid drugs. And Pfizer denied that their drug caused heart attacks at an FDA hearing in 2005. Despite that, they had unpublished evidence to the contrary, and they still called the evidence inconclusive in 2009 when they recruited people also in Denmark to take part in a trial. They said, we don't know if it causes heart attacks. They did. So by 2004, Vioxx had likely killed 120,000 people, and Pfizer's drug 75,000 people. It's not only these drugs. Now, we all know that diclofenac and ibuprofen can be brought over the counter in most countries. They also double the risk of heart attacks. Quoted Joseph Witt-Doring. He's a psychiatrist in Utah, a Utah psychiatrist. 24th of February 2024 on Twitter. He does a lot of Twitter videos. I noticed he took his surname off because he's probably been threatened by the politicians and the pharmaceutical people. This is one video he made on Twitter. What is the worst this is him speaking on the video. What is the worst combination of psychiatric drugs, or medications he calls them, but they're just drugs. They're not medication. They kill people. They're dangerous, toxic drugs. What is the worst combination of psychiatric drugs to be on? For me personally, that's going to be benzos, which is, I inserted there, central nervous system depressants, and opiates, analgesics, pain relief, antidepressants. This combination of medication can be deadly. When you combine them together, your risk of respiratory depression, or essentially falling asleep at night when you go to bed and having difficulty breathing, goes really high. It's so high that there's a box warning on all the opiates and the benzos, warning patients and their doctors about this risk. It's called fatal respiratory depression, which means the drugs kill the respiratory system and they kill the person. Fatal. That's what the word fatal means, death. When you're talking about drugs, pharmaceutical drugs. So it kills the respiratory system. That's why when they lock them up in those psychiatric facilities and buildings, they shine the torch in the room to check that they're still breathing, because they kill them. They kill people with the drugs, with the breath. They kill the respiratory system. They can't breathe and they die. Because it leads to more overdose deaths. I'll read that bit again. It goes so high, the combination of the drugs he's talking about, that there's a box warning on all the opiates and the benzos, warning patients and their doctors about this risk, fatal respiratory depression, because it leads to more overdose deaths, inadvertent overdose deaths, than I think any other combination of medications in the world. And I said, that's the end of Dr. Witt-Doering. Psychiatric drugs are not medication. They're poisonous, dangerous toxins that kill legions of people. Like I said, they kill about 8 million people a year with these drugs globally, and which is a Holocaust. It's a Holocaust greater than the Second World War Holocaust, and that's why it's all everything to do with this practice and these drugs. The death. That's based on 8 million a year they kill with this practice and these drugs, based on a medical report from 2015, a United States medical report, which I included in my book. Reed study psychotropic medication consumption in 65 countries, regions, 2008 to 2019. A longitudinal study, 8th of December 2021, scbi.nlm.nih.gov, psychotropic medicine, toxic drugs, sales increased from 28.54 DDD per 1,000 inhabitants per day in 2008 to 34.77 DDD per 1,000 inhabitants per day in 2019, corresponding to a 4.08% relative average increase annually. Consumption of psychotropic drugs has increased over a 12-year period, although the absolute growth rate was highest in high-income countries. The relative growth is highest in middle-income countries, especially upper-middle-income countries. Looking briefly at antidepressants, there are 7 categories: selective serotonin reuptake inhibitors, SSRIs, serotonin and norepinephrine reuptake inhibitors, SNRIs, atypical antidepressants, tricycle antidepressants, etc., etc. In a new study in JAMA Psychiatry, researchers found that children born to mothers who used SSRIs during pregnancy had reduced brain volume in multiple areas. Most brain volume reductions were still there at the follow-up when the children were 15 years old. According to the researchers, there was a persistent association between prenatal SSRI exposure and less cortical volumes across the 10-year follow-up period, including in the superior frontal cortex, medial orbital frontal cortex, parahippocampal gyrus, rostral anterior cingulate cortex, and posterior cingulate. The researchers were led by psychiatrist Dobucan Kok at Erasmus University, Rotterdam, the Netherlands, published by psychologist Dr. Peter Simons, Man in America, September 2023. Anyway, to go through how the psychiatric drugs, the medical people saying psychiatric drugs harm the baby in utero with pregnant women, how they're dangerous, how they affect the brain development mostly. But they also affect other things. I'll read this quickly. Serotonin is crucial for fetal development. SSRIs and other antidepressants disrupt the serotonin system. It's going to have an impact on fetal development. The scientific literature, how does it inform us on the potential impact on the fetus? SSRIs have been shown to impact the placenta. There are increases in miscarriage. They do cause birth defects, particularly in areas like the fetal heart, the fetal gastrointestinal system. We see increased rates of preterm birth, low birth weight. We see increased rates of the hypertensive diseases of pregnancy, like preeclampsia, affecting the mother. At the time of delivery, we see increased rates of postpartum hemorrhage in mothers. In the newborn period, there's absolutely a large difference between exposed babies and unexposed. Trouble breathing, jitteriness, sometimes with seizures, persistent pulmonary hypertension of the newborn, other respiratory issues. That's from USA obstetrician gynecologist Dr. Adam Urato, Executive Director of IBH Enter, Dr. Roger McFillin, September 2023. SSRIs cause temporary and permanent PSSD, post-SSRI sexual dysfunction in children and adults, and cause akathisia. They chemically castrate people. People have also committed suicide from PSSD and antidepressants induced anhedonia. That's from the PSSD network, pssdnetwork.org. Now, I'll discuss at this point, I've written here, all psychiatrists and all general practitioner doctors out there who argue for the safety and efficacy of their own psych drugs and other psychiatric practices. Go ahead and lock yourselves up, have your guard staff hold you down or physically restrained with equipment, inject all your own psychiatric drugs into yourselves, subject yourselves to ECT, psychosurgery, etc. I guarantee they'll all be dead in a week. They are death doctors. They kill people with their drugs and other violent treatments. If the public thinks these practices are acceptable, then imagine you are locked up by force. You can't get out, you're restrained, you're injected with dangerous drugs that can kill you, including when psychiatrists and their staff forcibly drug people in the community with community treatment orders, or the CTOs. They're killing their victims. It's a politically legislated and funded killing machine worldwide for 230 plus years, in some nations and regions more than 7 centuries. So what I'm saying there, I've said that a number of times, I'm saying if we lock up the politicians and the psychiatrists and the judges who enforce it and all that in their own buildings or in their homes, and we society forcibly inject them, which is very violent to do what they've been doing. If society forcibly injects them with their own psychiatric drugs, they'll all be dead in a week. They'll be dead in a week or a month or 6 months or a year or 2 years. And all the literature publicly, medical literature and other literature publicly admits that they die on average 20 to 30 years younger than the general population. So if they think that I'm wrong, okay, which I'm not, it's a Holocaust. And it has to be abolished. If they think I'm wrong, if society locks them up, judges, psychiatrists, politicians, and the management of the public trust for instilling billions of dollars of their dead and living victims' money and assets, we'll lock all them up in a building. Lock them up in their own buildings and inject them with their own killer drugs. If they injected themselves with their own killer drugs, they will be all dead in a week or a month or 6 months or a year. There, in 5 minutes, I've just proved that it's a killing machine. I've proved it's a killing machine in 5 minutes just by saying what I've just said. If it was done to them, they'd all be dead. They'd all be killed eventually. There's no argument. There's absolutely no argument. They can't argue against what I've said, the evidence that I've presented. They can't argue against it. Everyone needs to watch the documentary Psychiatry Industry of Death, published in 2006, which was created by the Citizens Commission on Human Rights. It's watchable. You can watch it on Rumble, BitChute and YouTube. The documentary has over 200 professionals, psychiatrists, psychologists, psych facility workers, academics, professors, historians, authors, teachers, doctors, lawyers, researchers, parents, victims, giving evidence regarding the eugenics, crime against humanity, factors, nature and history of the practice of psychiatry to today. It's just, the documentary just shows the tip of the iceberg. And one of the men that founded the CCHR was Dr. Thomas Sowse. He was a professor, and he wrote 23 anti-psychiatry books, including in his 1961 publication, The Myth of Mental Illness, proving the concept mental illness was a harmful myth without a demonstrated basis in biological pathology and with the potential to damage current conceptions of human responsibility. Dr. Sowse further argued that psychiatry threatened individual liberties through medical labelling involuntary, which is forced, violently forced commitment and forced treatment. I agree with Dr. Sowse, there is no such thing as mental illness. It's fake, lies and fraud. Later, I will prove it. It's gross defamation of the human character, emotions, feelings, experiences, thoughts and views. There's no objective medical assessment testing in psychiatry from the start. There never has been. There never will be. It's defamatory, subjective labelling, stigmatising of humans, character assassination. Yet those two erroneous words, mental illness, for more than 230 years worldwide, politicians, psychiatrists and their staff, doctors, judges, police have assaulted, tortured, maimed and killed millions of people, tens of millions of people killed. Two fake words, weaponised to harm and kill people. That's it. It's a politically driven, stealing, torture, assault, killing machine. It's eugenics. It's definitely a Holocaust. I say more than 230 years globally because many psychiatric buildings, or they call them facilities or asylums, were built in Europe, United States, Asia, Australia, New Zealand, Africa and the Middle East from before the turn of the 19th century. That's the 1800s. They're buildings with horrible names. That's it. However, the torture, assault, killing of people subjectively labelled mentally ill dates back more than 7 centuries. And one of the world's first psychiatric buildings is Bethlehem Royal Hospital, London, built as a monastery in 1247, used as a psychiatric building from 1377. At Bethlehem Royal Hospital, inmates were confined to cages, closets, animal stalls, chained to walls and flogged, while the asylum charged admission for public viewings and much more. The documentary Psychiatry and History of Death is a must watch if you care about people's lives. Then I quoted this man, Paul Chambers, who wrote a book. He was a British man, I think he's British, author of Bedlam, London's Hospital for the Mad, gives a detailed summary of London's Bethlehem Royal Hospital, BRH, and other privately run madhouses in the United Kingdom. For BBC History Revealed History Extra. Now, I go through all the horrific things that they did to people. Just absolutely horrific. He wrote about them, and he said a lot of these horrific things about what they did in that building from the 1377. You know, there's so much in the chapter that I don't have time. So this is why you buy and read a book, because you can't explain all this in even an hour video. Now, what he described is just some of the most horrific things that went on in the building, okay, which I summarised later in a lot of the practices that they did, and not just the drugging, but a lot of the other violent, horrific practices that they did in these buildings. So what I've said there is what is being described here at Bethlehem is not a hospital, it's a killing centre. It's a killing centre. To enter a building and be assaulted and tortured until you are dead is ruthless, cold-blooded murder. Other than Mrs. Hawley, I can't find any evidence that any other human came out of that building alive. Incredibly, it's still operating today. They just drug everybody, but they used to chain them to walls and flog them and all this sort of thing. I'll read some of it. Actually, no, I'll go through the practices that they do because I summarised it. Otherwise, it'd just be 2 or 3 hour long video. What's also shocking and vile is that the public took their relatives, friends and enemies there and also paid money to view and taught their torture and deaths. Every psychiatric facility, building or ward in the world throughout history today is not a hospital. At best, they're prisons. At worst, they're concentration camps, killing centres. Today, there are thousands of people in most nations, millions worldwide, who currently are forcibly locked up in these buildings. They can't get out. And on CTOs in the community, they're being murdered with psychiatric drugs and other violent treatments. Once again, I state, if politicians and their paid workers locking up millions were themselves locked up in their own facilities and forcibly injected with their own murderous drugs, they'd all be dead in a week. Australia is very bad for this practice. Politicians and their paid workers currently have 4.3 million Australians under it. They kill 75,000 people a year. That's based on this Australian Bureau of Statistics report about the deaths that was published in 2017. Based on a 2017 government Australian Bureau of Statistics death data report of 75,858 dead Australians in a 13.5-month period. I give most of the evidence of this report later. You can see why I've desperately been trying to get it abolished for over 10 years. I read article dailytelegraph.com.au, Ben Pike, 3rd of March 2015. Sydney's shameful asylums, the silent houses of pain where inmates were chained and sadists reigned. And a quote from him, the journalist: torture, murder, beating, sexual abuse, rape and death. The stories behind some of Sydney's best-known asylums uncover the institutionalised horror that shamed the city for decades. Once a patient was admitted, their complaints about grave injustices were often simply noted by doctors as first evidence of their, quote, delusion and insanity. For many, there was no escape. For many others, primitive electric shock therapy, murder, rape, neglect and outright sadistic brutality on the part of the staff made Sydney's asylums nothing more than silent houses of pain. Any place built on top of more than 1,000 anonymous corpses would send a shiver up anyone's spine. Tarban Creek Lunatic Asylum was Sydney's first purpose-built asylum, opened in 1838 at the aptly named Bedlam Point on the shores of the Parramatta River. The 1,000-plus corpses, dead people, under the asylum illustrated, that's the building, 1,000 dead people under the building, illustrated the stigma that, quote, mental health had at the time. Families refused to pick up their relatives' bodies when they died, forcing the institution to create mass graves. 1,000 dead bodies where the relatives put them in there, murdered their relatives, and they built a mass grave of the 1,000 dead bodies under that building in Sydney. Other deaths will forever remain a mystery, with many patients having no relatives or friends to speak of. They were all murdered. Okay, quote, and I said, you can read the rest. It's no mystery they were all murdered. Globally, for over 230 years, every government and private report you read, every research study and publication, every book, every media article, every documentary, every professional person and victim talking about deaths under this horrific violent practice. All these people have been murdered by politicians, their psychiatric staff, other government workers and the people who put them there. I will gladly publicly debate anyone on this practice and win. It has to be abolished. We need to examine how psychiatrists and their predecessor death doctors, which were called alienists and surgeons, have used subjectively invented, corrupted, manipulated language to create a Holocaust. Actually, before I do that, I'll do that at the end. I want to do that, because I want to tell you more about the evidence of the killing, of the actual killing that they've done. Okay, I can't cover everything from chapter 5. So, there's people that were quoted in that documentary about the children were murdered about how their children were murdered. And also they just murder people. I want to go through the actual deaths of the, here we go. Asylums became widespread from the 1700s. During the 18th century, 19th century, 20th and 21st century, psychiatric institutions called asylums and facilities were built and practiced across Europe, North America, South America, Africa, Asia, the Middle East, Australia and New Zealand. All politically legislated and funded, and later pharmaceutical company funded, creating a holocaust. Most institutions were inhumane, overcrowded, unclean. All treatments are classified as assault and torture, including chaining victims to walls, flogging them. All types of chains, ropes, restraint equipment was used. They still use restraint now, which is violently forced. All types of chains, ropes, restraint equipment were used. Drowning devices, such as putting people into coffins, dunking them in cold water, opening the coffin and trying to revive the person. They also wrapped bodies in sheets and dunked in cold water. Ice baths, removing blood from the head by restraint, cold water, bleeding and terror. Staff practices and substances induced vomiting and diarrhea. In a chair looking like an electric chair called the tranquilizer, victims were strapped to the chairs for hours. With cold water applied to their head and feet, they burnt and blistered the skin of their victims. Surgeons, wrongly believing mental illness had travelled in saliva down the body, removed body parts. They removed body parts surgically, teeth, tonsils, sinuses, stomachs, colons, spleens, ovaries, uteri, mutilating and killing their victims. Lobotomies, hydrotherapy, artificial fever therapy, malaria therapy, electric shock therapy, ECT, psychosurgery, deep sleep therapy, which is injections and oral drugs, induced coma, very, very dangerous practice that was. Insulin shock therapy, which is drug injections, insulin coma therapy, more drug injections, cardiazole, metrazole therapy, drug injections, which is phentylentetrazole, drug injections, deep cranial magnetic stimulation, vagus nerve stimulation, deep brain stimulation, and the worldwide mass drugging of millions of billions of humans with poisonous synthetic pharmaceutical chemical compounds, oral injection drugs since the 1920s. The mortality death rate from their violent treatments, practices and drugs have always been very, very high. Very high. It's not therapy, it's assault, torture, killing people. Like I said, the 5 charges against these people should be assault, torture, attempted murder, and stealing, because they steal all their wealth, they steal all their assets and bank accounts and all this horrific shit that they do. From the 1920s, psychiatrists used violent body and brain damaging practices including electric convulsive therapy, ECT, psychosurgery, deep sleep therapy, induced coma, insulin shock and coma therapy. They used to just chain them to the walls and flog them and beat them and starve them and rape them and shit like that. But that was in the centuries before. Even hang them in the street and all this sort of thing. Insulin shock and coma therapy, cardiazole, metrazole, phentylentetrazole therapy, deep transcranial magnetic stimulation, TMS, vagus nerve stimulation, VNS, deep brain stimulation, DBS, to maim, disable and kill millions of people worldwide. This is since the 1920s. Yeah. These people are possessed with the spirit of Lucifer. They feed off the fear and pain they inflict. Oh yeah, yeah, I've got Chelmsford. I've got the Chelmsford scandal and the killing of people in Chelmsford. There's some comments there. Yeah, it's cold-blooded murder. It's cold-blooded murder. It's all in the law as well, the political law. The law funding government workers, government money, public money, government, what they're called government workers. It's all murder. All of these violent practices are classified as torture. They are brain and body butchers. None of them are therapies good for humans. Psychiatrists, Austrian, now I'm going to go through a whole lot of these horrific violent practices that they've used since the 1920s. People think about lobotomies, they say, oh, lobotomies, they don't even do that anymore. But that's bullshit. They have what's called psychosurgery, which is a form of lobotomy. But the point is, they killed millions of people with these practices. Millions. Over the past 2 centuries, or more than 2 centuries. It has to be abolished. You can't have a practice that kills millions of people, and you can't have it in the law, and you can't have it in society. You just can't have it. So here's some of the evidence of how they killed their victims with these horrific violent practices. Psychiatrist Austrian-American Manfred Sackel and Hungarian Ladislas Joseph von Meduna induced severe brain and body damaging convulsions, seizures and epilepsy with insulin, camphor and metrazole injections. Insulin coma and shock therapy and the convulsive therapies are collectively known as the shock therapies. Pentylenetrozole, also known as letrozole, metrazole, pentrazole, pentamethyllenetrozole, corazole, cardiazole, Dumacard or PTZ injections cause dangerous, uncontrolled convulsions and seizures, disabling brain damage and death. Von Meduna and other psychiatrists used it from 1934 across Europe and the USA. In 1939, Britain replaced pentylenetrozole with electroconvulsive therapy, shock therapy, to induce seizures and convulsions. It wasn't until 1982 the FDA in America revoked its use, banned its use. Sackel introduced insulin shock therapy, also known as insulin coma therapy. It's not therapy, it's just killing people with the injections. From 1928, see how they lie about everything, they twist and manipulate language. I'll go through that later. From 1927, Sackel introduced insulin shock therapy, also known as insulin coma therapy, where victims were repeatedly injected with large doses of insulin to produce daily comas over several weeks. It was used extensively in the 1930s, 1940s, 1950s across Europe, the USA, Australia, and to a large degree replaced by neuroleptics, which is antipsychotics, in the 1960s. Psychiatrists would often further inject their victims with metrazole, also give ECT, electric shock treatment, after they had comatose them with insulin injections. It still existed in the 1970s in the USA, China and the Soviet Union. None of these dangerous practices are therapies. They're liars. They are soul torture, attempted murder and murder. Deep sleep therapy, DST, also called prolonged sleep treatment or continuous narcosis, was a very dangerous practice using massive doses of barbiturates and tranquilizers to induce deep coma for days or weeks. Barbiturates are also used for euthanasia, state-sanctioned murder, and capital punishment, which is by lethal injection. While comatose or awake, victims were often given additional torture, such as other drug injections, ECT and psychosurgery. First used by Scottish psychiatrist Neil MacLeod from the early 1900s. DCT was abandoned due to deaths and then reintroduced in 1915 by Italian psychiatrist Giuseppe Epifano. In the 1920s, Swiss psychiatrist Jacob Clacy used DST with pharmaceutical company Roche. He killed more than 12% of his victims directly. It gained more popular use in the 1950s, 1960s, 1970s, used extensively by British psychiatrist William Sargent, Canadian psychiatrist Donald Cameron and their followers. This is all funded by the politicians and in the law too. Sargent was president of the psychiatric section of the Royal Society of Medicine from 1956 to 1957 and a founding member of the World Psychiatric Association. Cameron was president of the following associations: American Psychiatric Association 1952 to 53, the Canadian Psychiatric Association 1958 to 59, the American Psychopathological Association 1963, the Society of Biological Psychiatry, 1965, and the World Psychiatric Association, 1961 to 66. Cameron has been widely criticised for administering ECT and drugs without consent, unethical medical experiments, and the development and use of psychological torture techniques for the CIA. Deaths are reported in various sources. Australian psychiatrist Harry Bailey was a close associate of Sargent. Bailey killed more than 24 people and over 900 victims suicided or left brain damage after release in Chelmsford Private Facility, New South Wales, with DST. A Royal Commission resulted. I will discuss more of this later. How obvious is it that they're torturing and killing their victims? It's obvious. What barbaric, sadistic savages. Society can settle any arguments they may present by rounding up all psychiatrists and politicians who legislated fund them to practice and subject them to their own above injections and treatments and see how long they live. Dr. John Friedman, USA neurologist, he's a USA neurologist, he said, Manfred Suckle had this notion that he could just kill the bad brain cells, that somehow we have good brain cells, we have bad brain cells, so if you give people enough insulin, you kill those bad brain cells, and if the person survived this epilepsy, they would be better off for it. Just absurd. Dr. Robert Morgan, USA psychologist and author, said, Von Meduna noticed his epileptics had no mental health problems and his psychiatric patients seemed to have no epilepsy, and so he thought doing one would obviate the other. Dr. Moira Dolan, USA physician, she said, the theory that epilepsy and schizophrenia, which is fake, schizophrenia is fake, I'll prove that in my book and I'll read that later, could coexist in the same brain, and that if epilepsy was induced, that a seizure was caused, it would, quote, drive out the schizophrenia. There is no scientific basis for this whatsoever. Electric shock therapy became electric convulsive therapy, is reported to be used as early as the 16th century. The use of electrostatic machines and induced seizures agents was documented in the London Medical and Surgical Journal from 1785. The publication Electricity and Medicine claims electricity was used on humans from 1744. In Rome Sapienza University, Italy, from 1938, psychiatrists Ugo Ciletti and Lucio Bini used electricity as a substitute for metrazole injections. During the 1940s and 1950s, ECT was given without muscle relaxants, causing fracture and dislocation of bones. From the 1940s, psychiatrists experimented giving their victims muscle paralysis poison curare, C-U-R-A-R-E, and drug suxamethonium while administering ECT. Muscle paralysis drugs can cause suffocation. They cause suffocation. They administer a short-acting anaesthetic with it. Anaesthetics are given in modern ECTs to squash victims' screams and paralysing drugs to avoid watching the writhing and agony. ECT administers 50 to 400 volts of electricity directly to the brain to induce seizures via the medial temporal lobe. It's not a natural seizure, it's electricity applied to the brain-induced seizure. How dangerous is that? 2/3 of people who receive ECT are women, half are elderly. ECT causes brain damage, short-term and permanent memory loss, heart palpitations, stroke and death. It's also reported as used for punishment and abuse, which is punishment and abuse anyway, that's what it is, it's punishment and abuse. Roughly 100,000 Americans have died from ECT at an annual profit of $1.2 billion. If politicians and psychiatrists think ECT is safe, they can prove it by administering it on themselves for weeks while restrained with their own injections. We'll see how fast it gets abolished. If they survive, if they live. ECT is still administered today worldwide. It's not therapy, they are liars. its brain and body butchering barbaric torture. It deserves to be abolished along with all their other disgusting violent practices and drugs. Dr. John Friedman, USA neurologist, quote, in Italy in 1938, two Italian psychiatrists, Ciletti and Bini, decided to observe that before slaughtering pigs, in order to make the pigs more docile, they would apply electrodes to their temples that were hooked up to wall current, and this stunned the pigs. But it didn't kill them, and they could then slaughter them. Well, this gave them the encouragement to try inducing convulsions with electricity on humans. Dr. Moira Doling, USA physician. From ECT, we would see teeth falling out, broken spines, bones knocked out of joint, broken bones, and people even getting internal organ damage from being restrained while they were having these uncontrolled rioting seizures, convulsions. Dr. John Freitberg, USA neurologist, says, the main misconceptions that people have about ECT is that it's new and improved. The new and improved refers strictly to these cosmetic improvements because, in fact, they make it easier on the witnesses. The person isn't shaking all over the table, they're paralysed now. It isn't new, it isn't improved, it is worse. Dr. Robert Morgan, USA psychologist and author. Every 10 years or so, there tends to be, first of all, a denial that ECT causes any harm. Secondly, an acknowledgement that it might cause harm, but there's a whole new approach, and now one is blameless, without any research to back it up. Louis Bass, USA attorney and industrial safety engineer. The ECT machine can produce anywhere from 50 to 400 volts of electricity. It's the kind of energy that we use for industrial machinery that might be in a steel mill or a printing press, some large piece of machinery. It's an extraordinary amount of energy and it causes a great deal of damage. The 2023, the Citizens Commission on Human Rights Australian National Office published South Australian psychiatrists want to continue electric shock on children. Make restraint use easier to give forced involuntary electric shock to both children and adults. The SA psychiatric law is currently under review. I was told on the phone by the Chief Psychiatrist's Office staff forced restraint for ECT is already permitted under the Guardianship Act. The review is to add it to the Mental Health Act. I blatantly said politicians and psychiatrists are assaulting, torturing and killing people with their dangerous drugs and other violent practices, including ECT. Some of these practices for over 200 years in Australia. The young lady was actually very understanding and apologetic. They know they're doing it. I've written a submission to SA politicians regarding this review. However, I've publicly spoken out in between federal and state elections for over 10 years to abolish psychiatric practice, drugging and laws. It's on my political website, so they definitely deserve to be jailed. So the CCH article says, electric shock is legal for use on all ages, including children, pregnant women and the elderly in South Australia. There are no proposals to change this. The South Australian Chief Psychiatrist, John Brayley, they should all be jailed straight away, now proposes the authorisation for restraint to forcibly give involuntary electric shock, which is forced. Involuntary is just a cushy word for violently forced. Electric shock is not obtained through a tribunal, so they just want to be able to do it without going through a tribunal. And those SAT judges, they're all guilty. They should all be jailed anyway, because they're already guilty of assault, torture, attempted murder, stealing, and murder. Instead, he proposes that the South Australian Mental Health Act is changed to allow psychiatrists to give authorisation for use of the restraint. This can only increase the use of restraint and could affect involuntary detained children who are treated without parental consent. Well, they're just killing these children. They're killing these children. Currently, restraint to give electric shock can only be done for urgent electric shock and then only with tribunal approval. That's the SAT judges, and they're guilty already, as I said. What is electric shock? ECT, also called electric convulsive therapy. It is the application of hundreds of volts of electricity to the head to create a seizure, convulsion. It can cause brain damage, permanent memory loss, heart problems, stroke and death. In South Australia, it can be given up to 4 times in one session to establish how much electricity is needed for a convulsion. ECT is not therapy, it is torture. Most people think ECT is already banned, and it should be. In South Australia in 2022 to 2023, there were 6,218 electric shocks given to 509 people. That's just one Australian state. And that's only a 2-year period. The South Australian Chief Psychiatrist reported that this included 0 to 19-year-olds, as well as elderly over 90 years of age. What is restraint? 1, the use of physical force to control or hold down a patient or a person. It's violent, physical force. They use security guards and equipment. 2, mechanical restraints, the use of cuffs, straps, etc. to restrict movements such as being cuffed to a bed or chair, and it should be done to them. It should be done to them, you know. And 3, chemical restraint, the use of psychiatric drugs to subdue and control someone. Restraint is traumatic and it can and does cause death. They kill people even with restraint, even with a violent restraint, the violence that they use. These people are horrific. They are so dangerous. What they've been doing is so dangerous, and for politicians to put in the law, that is just cold-blooded murder. Restraint is traumatic and can and does cause death. Restraint use is rife in South Australia. In 2022 and 2023 in South Australia there were 1,739 physical restraint instances, 44 instances of mechanical restraint, and 697 chemical restraint events. The United Nations, the UN, and World Health Organization, WHO, together issued a guidance on mental health and human rights legislation in October 2023. It states, coercive practices in mental health care violate the right to be protected from torture or cruel, inhumane and degrading treatment. Coercive practices include restraint and involuntary forced electric shock. The guidance calls on all governments to prohibit all coercive measures. The guidance says electric shock is an irreversible intervention that causes memory loss and brain damage. From 2013, the UN called on all countries to impose a total ban on all forced interventions, including involuntary electric shock and restraint, which Australia ignored. In 2019, the UN directly told Australia it should prohibit the use of non-consensual electroconvulsive therapy on the basis of any form of impairment. In 2021, the WHO said it was important for countries to eliminate practices that restrict the rights to give consent, which includes involuntary electric shock and restraint. South Australia has still not banned restraint or involuntary electric shock. There are no current proposals to ban either. Apart from the fact that both barbaric restraint and electric shock should already be illegal, to take away tribunal approval is give restraint for electric shock, as the Chief Psychiatrist proposes, can only increase the use of a traumatic restraint on involuntary detained patients, which is violently forced. Recommendations. 1. Both restraint and involuntary electric shock must be banned immediately. They are both torture and should be made criminal offences. 2. Psychiatrists should not be able to authorise restraint to give involuntary electric shock. Electric shock of South Australian children. The 2023 UN and WHO guidance states ECT is not recommended for children, and this should be prohibited through legislation. The SA law allows for the use of ECT on children, including involuntary forced ECT, without any parental consent needed. So they can torture and kill your children under the law. WA has made a start to rectify this area with an ECT on children under 14 years old. WA has made a start to rectify this area with an ECT ban. That's a ban, I missed the word ban there. On children under 14 years old, ACT ban it for children under 12 years old. The South Australian Chief Psychiatrist does not recommend ECT as banned for children in discussion paper on South Australian Mental Health Act review. Recommendation, electric shock must be prohibited on children immediately. Read also, SA children can be forcibly drugged, restrained, secluded and electric shocked. The CCHR Australia. And I've written there, not only does ECT deserve banning outright for both children and adults, it's assault torture, it can brain damage, maim people, cause death. Psychiatrists deserve to be jailed for it. Also for forcing their other violent treatments like psychosurgery, restraints, guard violence, abuse, dangerous drugs, their Nazi-like treatments, practices. From my submission, I received a response from South Australian politician Chris Picton, Minister for Health and Wellbeing, 7th of February 2024. Dear Teresa, thank you for your correspondence regarding electric-convulsive therapy in South Australia. The Office of the Chief Psychiatrist released a discussion paper on the independent statutory review of the SA Mental Health Act 2009 in November 2023, following the review undertaken by the SA Law Reform Institute, based at the University of Adelaide. Your feedback on this matter has been forwarded to OCP and has been included as part of the consultation process, which closed the 12th of January 2024. Feedback received will be used to inform the development of a draft bill to make amendments to the Act, which will be considered for both houses of the South Australian Parliament. Thank you for sharing your views on this matter. Yours sincerely, Chris Picton, MP, politician, is a Labor politician, South Australia. I won't hold my breath. It's like telling Hitler to stop assaulting, torturing, killing people. I already included the OCP in my submission. And I met Peter Melaniskis in Peterborough. I gave him my book in person. There was an event in Peterborough and he was there. Everyone was telling me he's going to be there. I was like, okay, I'll go give him my book. He tried to shake my hand, but I wouldn't shake his hand. The Labor politician, they're scumbags. And the Greens are scum as well. So I had my book in my hand to give to him, and a man standing next to me goes, oh, do you want the Premier to sign your book? And I laughed at him. I said, oh, no, I wrote this book. I said, I wrote this book and it's for him to read. And the mayor was standing there, right there, when I gave him the book. He tried to shake my hand, I wouldn't shake it. I told him, I spoke to him for about 2 minutes to his face. That's Peter Melaniskis, the man who calls himself the Premier of South Australia. Well, you know, they've got all these stupid titles and all this sort of, they're just evil bastards, really. And anyway, I talked to him for 2 minutes, gave him by hand my book, and said, you must read chapter 5 and chapter 6. And especially, but read the whole book. And I said, chapter 5, the politicians have been killing people with the psychiatric practice since 1811 in Australia. And lots of deaths and killing people in lots of horrible, violent ways over the 2 centuries. And with the drugs, very, very dangerous drugs, especially when it's forced and they turn people into drug addicts and all this sort of thing. And they're killing people with the drugs, and it has to be abolished. You have to stop it, right? And Peter Melaniskis said to my face, he said, oh, I don't know anything about it. He lied to my face. He absolutely lied to my face. He goes, oh, I don't know anything about it, and started to walk off. And I said, yes, you do. I said, yes, you do. You know all about it. You politicians know all about it because you've been putting it in the law and building buildings for it since 1811, and we're in 2025. So they just lie to your face. You know, they're murderers. They lie to your face. If they don't ban the practice of psychiatry in South Australia and other states, they just all definitely should be jailed. And I don't care what party, political party they're with. Dr. Maura Dolan, USA physician. For the last several decades, psychiatry has really been involved in what they call biopsychiatry, which is really trying to modulate behaviour, emotions, thoughts based on altering brain chemicals. But now we have these large pharmaceutical companies saying they're not even going to research that area anymore, and increasing literature reports that these drugs don't even work and never did work. She's a USA physician. The attention is now being put on direct physical and electrical applications to the brain. The biggest example of that, and one of that's most experienced, is electric shock, ECT. But there's all other variations on that, such as transcranial magnetic stimulation, vagus nerve stimulation, deep brain stimulation, all different ways of applying electricity and magnetism to the brain, which is just very, very dangerous. It's very dangerous. Like I said, it should be done to the politicians and the psychiatrists and the judges. Let's do it to them. The society needs to do it to them. We'll see how long they live. Transcranial magnetic stimulation, TMS, administers powerful electromagnetic waves directly through the brain. 3,000 electric pulses a minute for 40 minutes at a time, 5 times a week for 6 weeks at a cost of roughly $12,000 US. TMS has a very high failure rate and causes migraines, seizures, and causes suicide. Vagus nerve stimulation, VNS, has a battery pack surgically implanted in the chest, sends electrical impulses every 5 minutes along the vagus nerve that connects the brain to the heart. VNS has a high failure rate, costs $10,000 to $25,000, causes neck pain, breathing problems, difficulty swallowing, and life-threatening cardiovascular problems. Dr. Moira Dolan, USA physician, the best studies that have shown that 70% of the time DMS is completely ineffective. When we look at supposed 30% benefit rate, we've got to remember that 20 to 25% is due to placebo. Dr. Colin Ross, Canadian psychiatrist and director of the Ross Institute. With TMS, there's no rational scientific way to justify invading your brain with damaging input in order to get the same response as placebo. Just take a placebo pill. With VNS, it's like a pacemaker in your chest attached to the vagus nerve that connects the brain to the heart. And you stimulate the vagus nerve for some reason that sends a signal up your brain up to your brain, which for some reason is supposedly to jazz up your chemicals and affect your mood state. Really, we have no idea really how it works, why it should work. It's not based in any real knowledge of medicine. Dr. Norman Shealy, USA neurosurgeon. VNS was developed first about 1966. They were doing it to treat high blood pressure. It didn't work, and so I guess they've been looking for something to do with it ever since. Just brain butchers, you know. One of the world's foremost proponents of vagus nerve stimulation, USA psychiatrist Mark S. George, openly admits they don't know how it works. There's no science behind it. He also advocates for and uses functional magnetic resonance imaging, positron emission tomography, brain stimulation, transcranial magnetic stimulation, deep brain stimulation, DBS, electroconvulsive therapy, ECT. George and others like him are brain butchers. Would you submit yourself to brain-damaging practices? These barbaric, torturous practices deserve to be abolished, not government-funded and forced on people. Quote from Mark S. George, the psychiatrist director of Medical University of South Carolina. Fundamentally, we don't know how it works, VNS. We don't know how it treats depression. Fundamentally, we don't know what depression is in the brain. Unfortunately, we need a lot more science research about that. We do have ideas and theories. Deep brain stimulation is another shocking, destructive practice that has metal wires implanted deep into the brain, subjected to continual electrical jolts through a battery pack surgically implanted in the collarbone area. DBS has existed since the 1950s under Central Intelligence Agency psychiatrist Robert Heath. Experimenting in human behavioural control. DBS is described by medical people as a serious and potentially risky procedure, very experimental. DBS causes cerebral infection, insomnia, delirium, bleeding in the brain, brain damage, death, with a suicide rate 400 times above the average. It costs roughly $30,000 per operation. Dr. Jeffrey Scaler, Professor, Department of Justice and Law, American University. Without a doubt, when you put an electrode in the brain and you constantly administer electricity, there is a psychological change that occurs on a continual basis. That's why this electrode is put in the brain, but we don't know what the effects are in the long run. Just killing the brain. Lobotomies. You want to hear about lobotomies? There's lots and lots more evidence, so much evidence. I can't read all this chapter out. You've got to buy the book and read it for yourself. Lobotomies were horrid brain-killing procedures that surgically severed the connection of the frontal lobe from other parts of the brain. Talk about barbaric brain butchers. The surgery severed most of the connections to and from the frontal cortex and the anterior front lobes. In 1935, Dr. Egas Meniz, Portuguese neurologist, drilled 2 holes into the person's skull, squirted pure alcohol directly into the brain, inserted a sharp instrument, a leucotome, Leucotome, raked it side to side, cutting connections from the frontal lobes to the rest of the brain, killing the tissue of the frontal lobes. Meniz called his procedure a lobotomy, also known as leucotome. Lobotomy. In 1949, they gave Maniz a Nobel Prize, the criminals. Lobotomies cause severe brain damage, mild brain damage, bleeding in the brain, intellectual impairments, decreased cognition, destroyed initiative, inhibition, weight gain, stupor, emotionally blunted personality defects, disability dependence, memory loss, seizures, incontinence, and suicide. Lobotomies directly killed 5% of their victims. From the early 1940s to 1951, they performed 20,000 lobotomies in the United States and more in the United Kingdom. A significant number of victims were gay men. More lobotomies were performed on women than men. In a 1951 study proved that 60% of American lobotomies were performed on women, and 74% of lobotomies in Ontario, Canada, from 1948 to 1952 were performed on women. From the 1950s onward, lobotomy began to be abandoned in the Soviet Union and Europe. Psychiatrist Walter Freeman alone lobotomized over 3,500 people in the United States. There was no anesthesia. This is Dr. Maura Dolan, USA physician. There was no anesthesia, and Freeman would just lift up the eye and stick nothing more than an ice pick right into the brain, right into the orbital bone, then rake the thing back and forth until he was satisfied he caused enough disruption of brain tissue, then pulled it out. He would pull up and offer lobotomies to people, get referrals from the local doctors, or sometimes people didn't even go through doctors, they'd go right to the lobotomobile, and he would do the brain damaging procedure right there. Dr. William Glasser, MD, USA author, Reality Therapy. They lobotomized 1 million people in the 1940s, 1950s, and the beginning of the 1960s until they came to the conclusion that this was a destructive treatment. Psychosurgery is another barbaric brain-killing surgical procedure. It's a form of lobotomy. It was first used by Swiss psychiatrist Gottlieb Burckhardt in 1891. It's a barbaric collaboration between psychiatrists and neurosurgeons. They remove or destroy, ablation, a small piece of brain through creating lesions by radiation. Thermocoagulation, electrical heat, freezing, burning, or cutting. It's done under general anaesthetic using stereotactic methods. The most common types of psychosurgery in current or recent use are anterior capsulotomy, cingulotomy, subcaudate tracheotomy, and limbic leucotomy. They target brain structures including amygdala, hippocampus, thalamic, hypothalamic, nucleus accumbens, prefrontal, orbitofrontal cortex, and gingulate gyrus. Psychosurgery has caused serious brain damage, mild brain damage, bleeding in the brain, seizures, incontinence, decreased drive and initiative, weight gain, memory loss, cognitive and affective disability, and death. It's still legal and done in China, India, Japan, Australia, banned only in New South Wales, the Northern Territory, and to some extent Queensland. New Zealand, it's illegal. Europe, Belgium, France, Spain, England, Russia, North America, USA, Mexico, Canada, South America. Barbaric brain butchering, murdering criminals, what horrible, evil people doing lobotomies and psychosurgery. Politicians and psychiatrists are horrible, dangerous criminals, what they use the law and public money for. Let society give them lobotomies and psychosurgeries. We'll see how fast it gets banned if they survive. No human should touch the brain like this ever. And then I read all this other evidence, a huge amount of evidence from all these different professional people. It's just full of evidence of a huge amount of professional people around the world. ADHD, it's a scam. It's bullshit to drug and kill children. mostly. ADHD. You know, let me read some stuff about this. Some of this, what these globalists did. The globalists in the psychiatric field. Robert Whitaker, author. Is there an unholy alliance between the psychiatric community, the pharmaceutical industry, and the FDA? And the answer is yes. In 1997, pharmaceutical companies like Novartis, Eli Lilly, Merck, GlaxoSmithKline convinced the FDA to allow them to advertise directly to the American public, with psychiatrists providing medical endorsement, resulting in a tripling of sales and profits. After 3 years of violence and suicide victims reports, public outrage forced the FDA to issue black box warning labels on psychiatric drugs. Major General Canadian psychiatrist George Brock Chisholm, co-founder World Federation of Mental Health, 1956 to 57. Quote, "We have swallowed all manner of poisonous certainties fed us by our parents and school teachers. If the race is to be free from its crippling burden of good and evil, it must be psychiatrists who take the original responsibility." Oh, really? Canadian psychiatrist Heinz Leeming said in the speech, quote, Psychiatry should actually go into government, that politicians should listen to psychiatrists. Psychiatrists should be in every parliament and should direct and monitor political activities. They already do. What a nightmare. That's why I added. Dr. Colin Ross, Canadian psychiatrist, director of the Ross Institute. People aren't aware that in 1940, a prominent British psychiatrist, Colonel J.R. Rees, as president, addressed the National Council for Mental Hygiene and set the agenda for psychiatry for the next 60 years. Since then, psychiatrists have been given authority in nearly every sector of society with tragic results. Colonel John Rowlands, J.R. Rees, British psychiatrist, president of the National Council for Mental Hygiene in 1940, said, quote, "We must aim to make psychiatry permeate every educational activity in our national life, public life, politics and industry. Should all of them be within our sphere of influence? We have made a useful attack upon a number of professions. The two easiest of them naturally are the teaching profession and the church. The most difficult are law and medicine." And I said there, what an evil, violent psychopath. Major General Canadian psychiatrist George Brock Chisholm, co-founder of the World Federation for Mental Health, quote, "To achieve world government, it is necessary to remove from the minds of men their individualism, loyalty to family traditions, national patriotism and religious dogmas." And then I said there, another evil, violent psychopath. He is. George Brock Chisholm was also one of the founders and the first Director General of the World Health Organization from 1948 to 1953, a globalist organization wanting to dictate medical tyranny on the world's population. On the WFMH impact on education and schools, Beverly Eichmann, Executive Director of the USA National Education Consortium, the WFMH actually said the purpose was social control, not to pass on knowledge, not to give him something so he can go into the world of work. On the 1950 Washington, D.C. White House World Psychiatric Conference on Mental Health, Beverly Eichmann, the Executive Director of USA National Education Consortium, says, "The White House Conference on Mental Health in the 1950s was a landmark that served to bolster the idea that schools could serve their communities better as mental health clinics than they would as institutes of learning." Dr. Jim Nichols, USA author, Voice of Freedom. In the early 1960s, the world of psychiatry started to really go places in this country. Little by little, it came into our schools, our education system. By 1965, it was written into USA law. Psychiatrists were given the green light for the wholesale labelling and drugging of school children. The subjective labelling of attention deficit hyperactive disorder, ADHD, went into full swing in 1987. Within 1 year, 500,000 United States children were diagnosed with ADHD and drugged. By 1997, that number had soared to 4.4 million. 4.4 million children. As a qualified physical and health education teacher for 28 years, I maintain it's 100% criminal to maliciously label and farm as psychiatrically drugged children like this. Children need exercise and other creative activities, not dangerous drugs that kill people. And so much more on about, look at this monster, what they said about ADHD. Beverly Eichmann, Executive Director, USA National Education Consortium. A child is labelled ADD or ADHD the minute he can't sit still for 10 to 15 minute period of time, or he talks constantly or ignores the teacher completely. That will earn him an ADD or ADHD label. In response to widespread public concern at this apparent epidemic of ADHD, the USA government-funded National Institute of Health assembled a panel of prominent doctors and psychiatrists to explain to parents and educators what ADHD was. The Consensus Development Conference on ADHD was conducted in 1998. At this 1998 conference, David Kupfer, Psychiatrist Consensus Development Conference panel chair, quote, he said, "I would like any member of the panel to describe a typical ADHD in terms of symptomatology, Mark. Would you like to?" And he was laughing. "Since you see them in your practice." Dr. Mark Vonnegut, paediatrician, his response, quote, listen to this criminality. There are, I think, this is what he's saying, this paediatrician, quote, I think that the panel has been frank in, the difficulties here are immense in terms of, it is hard. It's very hard to know how to answer this question. They cannot, they are as if driven by a motive. There are some good clinical descriptions, and I think, I do think part of the problem is that the profession keeps changing the diagnosis. That's his definition of ADHD. It's a scam. It's fraud. David Kupfer, psychiatrist, Consensus Development Conference chair, quote, he says, "At this time, we do not have a diagnostic test for ADHD. Therefore, the validity of the disorder continues to be a problem." And I said, despite these shocking admissions of no basis to their fake subjective ADHD labels, 2 years later in the year 2000, over 6 million United States children were labelled with ADHD and given dangerous drugs like Ritalin, Adderall, Concerta, classified by the FDA as highly addictive substances along with cocaine, opium, methamphetamines. In 2006, over 20 million children worldwide were subjectively labelled with some form of fake mental disorder and pharmaceutical drugs. It's pure evil and criminal to do this to children. In 2011, the Institute for Safe Medication Practices published a study of the top 10 most violent-inducing psychiatric drugs as Pristiq, Effexor, Luvox, Halcyon, Strattera, Lariam, amphetamines, Paxil, Prozac, and Chantix. Oh, and on and on and on and on it goes. It's just criminal. And there's, I did a big analysis, and they have, the psychiatric laws here. The world's politicians' psychiatric laws violently use forced incarceration. They call it involuntary commitment. Involuntary is a cushy word for violently forced. Violently forced. Their laws include the use of police to forcibly lock up their victims in a government facility or government-funded private facility, which is assault, torture, control, slavery, and attempted murder. They can't get out. It's exactly what the Nazis did. Police lockups and prisons are exactly the same, without trial especially. Psychiatric laws and facilities are worse than prisons, as 99% of their victims have not committed and are not charged with any crime. They cannot leave and are forcibly injected in the body or orally forced with poisonous toxic drugs that can kill you, and their other violent treatments can kill you. Forced injection in your own home is also imprisonment, control, slavery, and attempted murder because they use the police to enforce it, so it's Nazism. Government judges, magistrates, presiding members who give orders in courts and administrative tribunals all support forced psychiatric lockup and kill treatments. For these reasons, psychiatric facilities worldwide are in practice the same as concentration camps, all politically legislated and funded. When politicians and their paid workers use the law to round up large numbers of people for political and sociological reasons or any other subjective reasons, forcibly lock up and drug people in psychiatric facilities and in the home, they're administering a concentration camp system. In Australia, they include a section in their psychiatric laws for Aboriginal people. This is specified eugenics. Eugenics is a school of thought and practices that seeks to manipulate reproduction and alter human gene pools by excluding, murdering people and groups judged to be inferior or promoting humans judged to be superior. From the start, psychiatry has always been politically legislated and funded eugenics worldwide. The extermination of certain types and groups of people, vulnerable people, poor people, the homeless, the unemployed, the disabled, black minorities, vulnerable women and children, originally against and now supporting LGBTQ plus agenda. Homosexual and transgender people generally don't reproduce. Political and social dissidents, more recently white people, are subjected to psychiatric eugenics killing. It's especially the powerful wiping out everyone else pretty much. And politicians and psychiatrists have also killed millions of Jews and Christians with their murderous practice. LGBTQI plus people, Christians, infidels, women, dissidents are also wiped out in Islamic nations. That's eugenics. Also, German Nazi politicians used the same types of eugenics laws, policies and practices to fill and run concentration, extermination, labour camps across Europe. Nazi politicians used psychiatrists, doctors, police, soldiers to carry out their genocidal practices, genocidal policies over 12 years from 1933 to 1945. 99 to 95% of the people that ran that were men. Today, politicians legislated and funded psychiatric holocaust is worse than the Second World War, as it's been occurring worldwide for more than 230 years, in some areas of the world for more than 7 centuries. Now, I'll go on about the eugenics, about what eugenics, the whole history of eugenics. And eugenics is just about killing people, which, I'll go through the whole sterilisation. I went through how they sterilised people all across the world. Okay, sterilisation is killing people because you can't have children if you're sterilised. And how Adolf Hitler and his Nazi politicians used psychiatry and the medical people, so-called medical people, to kill millions of people as well. And they were basically behind the German Holocaust of the Second World War. So I'll go through all of that, all the history of that, and all the, all the history of this, what they've done there, and all the killing there, and how most of them were let out of prison. Some of them were hung after the Second World War, and some of them were jailed. It's a lot of them in the 1950s, they were let out of jail. They were let out, some of them. They had trials, they had all these trials, and I went through all the history of that as well. And I just wanted, there's just so much information, but so much evidence. I can't go here. The deep sleep therapy, Chelmsford Private Hospital, Sydney scandal involved psychiatry Harry Bailey, psychiatrist John Heron, general practitioner John Gill, general practitioner Ian Gardner, and other government workers. This is in Sydney. Harry Bailey was Chelmsford administrator. John Heron was recruited by Bailey to conduct electric shock therapy and deep sleep therapy. He was Bailey's closest associate and acted as Bailey's registrar in a part-time capacity. John Gill was Chelmsford medical superintendent and had a third ownership stake. He economically profited from it. Heron was also at the same time superintendent at an authorised psychiatric facility for 13 years from 1963. He worked along with Ian Gardner. Ian Gardner worked as a medical officer in psychiatry for the New South Wales Health Commission from 1967 to 1978. At Chelmsford, between 1962 and 1979, more than 24 victims were directly killed as a result of deep sleep therapy. Another 24 committed suicide after being released. In all, 183 deep sleep victims died either in Chelmsford facility or within a year of being released. 977 people were left brain damaged. A total of 1,127 victims were subjected to DST at Chelmsford. Staff said Bailey had sex with some of his female victims, ordering them sent by taxi to his office or home late at night. He also had a special room at Chelmsford facility where he had sex with selected female victims. This is clearly premeditated serial rape. He ended up committing suicide. And I wrote all about it and some of the court cases and the people involved and other books that are written about it and and quoted all my sources. And the judges, I named all the judges involved in that and who did the right thing and who didn't do the right thing. The Chelmsford murders are just the tip of the iceberg of psychiatric deaths in Australia for 213 plus years since 1811. In 2017, the Australian Bureau of Statistics published an incredibly important report entitled Mortality, which is death, of people using mental health services and prescription medications, proving out of 3.2 million people under psychiatry at the time, 75,858 people died over only a 13.5-month period from the 10th of August 2011 to the 27th of September 2012, being 49.4%. It's all in the report. This is all from this report, okay? Being 49.4% of the total 153,451 Australian deaths in that period. That's the total number of deaths. So half the people that died in Australia in that period were all killed under the psychiatric practice or pharmaceutical drugs. Out of 75,858 psychiatric deaths in that period, 49,483 were aged under 15 and over 74 years, which was 65.2%. 26,375 were aged 15 to 74 years old, which is 34.8%. 35,457 were men, which is 46.74%. 40,401 were women, which is 53.26%. This proves psychiatric staff killed 4,944 more women than men. 6.52% more women were killed with these pharmaceutical drugs and other violent practices. The report proves the death rate for people under psychiatry was twice as high than the general population. The death rate for men was 2.3 times higher and women 1.7 times higher than men and women in the general population. The death for people aged 15 to 74 years was 2.4 times higher for men, 2.9 times higher, and women, for men, death for people aged 15 to 74 years was 2.4 times higher, for men 2.9 times higher, and women 2.2 times higher than men and women in the same age category in the general population. Remarkably, the report proves the death rate for intentional self-harm for people under psychiatry was 3.3 times higher than the death rate for intentional self-harm amongst the total Australian population. This proves people self-harm and or try to and do kill themselves 3.3 times more under psychiatry than if they weren't under it. Proving everyone is 3.3 times healthier without it. If psychiatry worked, the death rate for intentional self-harm would be much lower than that in the general population, not 3.3 times higher. In other words, people were killing themselves 3.3 times more than the general population under the practice of psychiatry. That means if you're in the general population and you're not under that practice, it's 3.3 times less chance that you're going to kill yourself. So what does that tell you? It tells you that people kill themselves more under that practice than the general population. Again, this 2017 ABS report proven 75,858 deaths is just the tip of the iceberg of deaths under psychiatry in Australia. It's only a 13.5-month period, with their practice legislated and funded for over 213 years since 1811. I conjecture more than 1 million dead Australians since 1811. The ABS would have got this death data from government computer records. The 2017 ABS death data report is on the internet. I also have PDF copies. Refer to key findings and death data table, pages 5 and 6. An annual death report needs to be produced for the past 50 years when almost 50% of Australians who die every year are under this violent psychiatric killing machine. That also includes other pharmaceutical drug deaths, but they put it all in the same report. And it's all people using mental health services and prescription medication deaths. Mortality of people using mental health services and prescription medication, 2017. They're all dead, these people. Dead people. Half the people who died in the country died under this report in practice. And I did a further analysis of some of the data. In 2011, 3.2 million Australian people were under psychiatry. In December of 2018, the number increased to 4.2 million. 20% of the population, Australian Bureau of Statistics, ABS, this is a horrific figure. In 2022 stated 4.3 million people, which is 21.5% of the population. The source is the ABS, Australian Bureau of Statistics, and the AIHW 2023 published. And in December 2023, the ABS and AIHW published 42.9%, or 43% of Australians, 8.5 million people, aged 16 to 85, had at some time in their life been under the psychiatric system. That is horrifying. That is just absolutely horrifying. Absolutely horrifying. 43% of Australians, they drug 1 in 7 children and adolescents aged 4 to 17 years. The source of that is the AIHW, aihw.gov.au. That's a horrific practice. 1 in 7 children. The AIHW claims it's diagnosed mental disorders. 3.4 million, 17.2% of the population for anxiety. 1.5 million, 8% for affective. 650,000 for substance use, 3%. All 100% erroneously subjectively labelled and stigmatised. None of these experiences are disorders at all. A shocking 38.8% of people aged 16 to 24 years were subjectively labelled with a mental disorder. It's fake. It's fake. I proved it in my book. I have to go over that. I'll have to go over that in a minute. Politicians and their paid workers have enforced hopelessness and helplessness. Shocking. There are over 55 specialised psychiatric facilities since 1811 to today, either closed or still open. Additionally, in 2020-21, there were 162 public hospitals and 70 private hospitals providing psychiatric services, 13,100 specialised psych beds nationally, 7,100 psych beds in public hospitals, 3,580 psych beds in private hospitals, 2,420 in private psych residential buildings, plus over 4 million people drugged at home, forcibly or not forcibly. And if they're not forcibly drugged, they're drug addicts. They turn them into drug addicts with dangerous drugs that can kill people. In 2021, there were 3,960 psychiatrists, most of them should be jailed, 25,000 psych nurses, 31,430 psychologists, 2,600 psych occupational therapists, and 2,600 psych social workers, all under the politically legislated and funded direction of psychiatric killing. Paid by the public, more than $12 billion a year. That's AIHW. How can 3,960 psychiatrists have politically legislated funded power to assault, torture, potentially kill 4.3 to 8.5 million Australians with Big Pharma and their other violent practices? Thousands of people in each state are forced under the public trust and guardianship system where they steal their assets and bank accounts, control bank accounts, while drugging them to death, all approved by judges, politicians and police. There's only 1% of the population that are doing it to the millions. As long as people can communicate, even in a tiny bit in some way, even blinking, you can say, ask them a question and they blink. As long as they can talk a bit or write or communicate in some way, as long as people can communicate even a tiny bit in some way, public trust and guardianship should never, ever be used. Ever. Never. In fact, the current guardianship and public trust system has to be shut down. It's a horrible slavery stealing scandal. Thousands in each state are forcibly drugged under community treatment orders, CTOs. Collectively, this is exactly what Hitler and his politicians did. It's a horrific, shocking scandal. The world's politicians and their psychiatrists have killed more civilians in 230 years than Hitler did in 12 years. People need jobs, study, to be inspired, encouraged, supported, not stigmatised, drugged, debilitated, and have no purpose. And then I talked about how GPs are contributing to this forced psychiatric drugging in Australia. It's psychwatchaustralia.com and aihw.gov.au published data research psychiatric drugs in Australia, who is taking what. Australians, quote from them, Australians among the world's highest users of psychiatric drugs. From July 2020 to June 2021, more than 1 in 6 Australians, 4.5 million plus people, being 17.7% of the population, were dispensed at least one psychiatric drug. Antidepressants were given to 3,503 people, 862 people. Anxiolytics, 904,253 people. Hypnotics and sedatives, 618,952 people. Antipsychotics, 493,850 people. Stimulants, 288,098 people. Hundreds of thousands of people were dispensed more than one type of psychiatric drug. The actual number is unclear. Despite the fact they have limited psychiatric and neurological training, the vast majority, 84.7% of prescriptions were made by general practitioners. That is absolutely frightening. Psychiatrists only prescribe 7.5% of the total number of scripts. It would have to be 15.3%. That's wrong. Older Australians were the most drugged, with a staggering 41% of those aged over 84 years dispensed at least one psychiatric drug, just killing the elderly with psychiatric drugs. Rates of drugging rose progressively through the older age groups. 75 to 84 years, 32.9%. 65 to 74 years, 26.6%. 55 to 64 years, 23.6%. 45 to 54 years, 22.6%. 35 to 44 years, 18.5%, 25 to 34 years, 14.9%, 18 to 24 years, 14.1%, 12 to 17 years, 9.5%, 5 to 11 years old, 4.8%. 5 to 11 years old, 4.8% of those being drugged, children at that age. 12 to 17 years old, 9.5%. And 0 to 4 years old, 0.2%, giving 0 to 4-year-old children psychiatric drugs. That's 14.5% of the people drugged with children aged between 0 years and 17 years. That's frightening. More women are drugged than men. 21% of women are drugged, 14.3% of men are drugged. Inner regional areas has the highest rates of drugging, 22.2%. 22.2%. Outer regional areas, 20.2%. Major cities, 16.5%. Remote, 14.3%. Very remote, 8.2%. And on and on and on and on and on and on and on. 45.6 million psychiatric drugs were given in 2022 to 2023. That's mental health related prescriptions, aihw.gov.au. 45.6 million psychiatric drugs. 4.8 million people, 18% of Australians were given psychiatric drugs, 84.7% of psychiatric drugs given by GPs. Number of people in each state given one or more psychiatric drug in 2022-2023, New South Wales, 1,411,532 people. Victoria, 1,204,743 people. Queensland, 1,089,000 people, 556 people. Western Australia, 530,288 people. South Australia, 357,026 people. Tasmania, 135,633 people. The Northern Territory, 25,972 people. And on and on and on and on and on. I wrote a bit about Dr. Helen Segunas, what they did to her, brilliant doctor in Victoria, and the criminals destroyed her medical practice. And Dr. William Bray, he apparently just quit his political candidacy, don't know why. Both those doctors, Dr. Segunas and Dr. William Bray, I would put in charge of the medical board, APRA. I'd put those two doctors in charge of the medical board, and any other doctors that they think should go on the medical board to just clean up this whole disgusting forced pharmaceutical drugging of Australians. Anyway, she needs compensation. She needs a medical licence re-established and compensation, and being put in a leadership role in the APRA or some medical leadership role. One really criminal thing politicians do, they created the fixated threat assessment centres where they threaten people or allegedly contacting politicians, other government workers, and or speaking publicly about them. I wrote stuff about that. And, Angela Georgianis and her brother politician, Stephen Georgianis, federal politician for Adelaide, what a criminal he is, and how he's destroyed, they threatened me as well just for making a video with her talking about this horrific stuff that they do. Just so many cases. But there's other important things I wanted to read about. All the stuff about the Nazi Holocaust, why I called it a Holocaust, is similar. There's so many similar things in the psychiatric field. So many similar things. And the death rates are just massive, millions and millions, 8 million people a year globally. The United States is very bad for this. Europe is very bad for this. Asia is very bad for this too. There's 58% of the world's population is Asian. Do you know that? And they kill legions of people there with pharmaceutical drugs as well. Now I want you to go through some of the subjective labelling. How much time have I got? I don't know how much time I've been going through. I think the battery's going to be flat in about 20 or 30 minutes. But I went through some of the other practices. Children that have been drugged as well. More children in Australia being drugged, and just the parents drugging their children with psychiatric drugs. It's just horrific. Absolutely horrific. And how I talked about how people have problems in life, but they need compassionate non-drugging counselling. I talked a lot about that. Compassionate non-drugging counselling. And voluntary. It must be voluntary. You can't forcibly do things to people in their home and in a building, in a government building. You can't violently force people. It's just violence. And if people voluntarily want support and help, counselling, non-drugging counselling, or go to a building somewhere under supervision in the home or in the building, it must be voluntary. I also talked about how psychiatrists lie about everything. Psychiatrists also lie about everything. They lie about language. They lie about people's very existence when they say humans are diseased, ill or disordered. They lie when they character assassinate and defame everyone. They add lies about anything to harm everyone. They lie about their violent practices and dangerous drugs, falsely claiming they're safe and effective. They lie when they destroy people's health. They lie when people die under their practice, taking no responsibility whatsoever. Psych staff and drug companies lie when they falsely call their dangerous drugs medication. They lie when they say side effects, not accurately direct effects. They are lying, predatory psychopaths. Notice how these lying psychopaths making up their fake rubbish, fake labels, words, drugs, are 99% men. The men that made up these fake labels. And I'll go through all the history. I'll go through all the history of this one here by this research article, 4th of October 2023, Ben Knight. Nearly a third of patient deaths in mental health wards potentially avoidable. Study, New South Wales. Claimed over a 10-year period, 471 people died in New South Wales psychiatric wards. 141 deaths were avoidable. And then I've said, I guarantee you 100%, all 471 people in that study were murdered by psychiatric staff. It's 100% impossible to commit suicide in a psychiatric facility, building, ward. Impossible, as it's highly supervised, secured, locked. Their victims can't have or get access to anything that would enable them to commit suicide. They also have 24/7 security. It's 100% impossible. You also can realise all 471 people are dead because they are imprisoned in the facility. They were forcibly put there. They're imprisoned in the building, in the facility. They can't get out. The same applies to all other deaths in such buildings in Australia and globally. So all the deaths are avoidable by shutting down, abolishing the practice. Psychiatric staff lie about everything. And then I went through about the DCM and all the history of the DCM and all the labels and children that have been raped in some of these buildings and adults that have been raped and sexually abused. I went through all the history of the words, all the labels that they make up. Before I read about the labels, I just want to read about something else here. There's something else that I really need to read to you, and that's about some of the practices that they use before the asylum system, the building system, where they put millions of people in those buildings, right? They had all these really violent practices before that, going back to the Middle Ages, which is, more than 7 centuries. And I just need to find that. Sorry, I really need to read that out to you. And that's all about the DSM. Excuse me a minute, just while I find it. Here we go. Asylums became... I think I read that already. No. I've got other things that I need to read to you. About the Middle Ages, when they actually had other practices. Sorry, just go and get a glass of water or a cup of tea or something while I find this. Hang on. That's eugenics. I went through the whole thing about eugenics. I don't know, I might have to make another video about this because I don't know if I can find it. The bit about eugenics is really important too. I might have to make a part 2 video for this because hang on. Sorry about this. I really wanted to read out this bit. I should have tagged it. Deep sleep therapy. I went through all that. I don't think I can find it. The people that were murdered. Do you know the man that created hand washing for birthing mothers was murdered in a psychiatric building. Do you know that? I'm reminded of the brilliant Hungarian obstetrician Ignaz Semmelweis, who was murdered in 1865 in a psychiatric building for inventing hand washing in obstetrical clinics to save the lives of birthing mothers. His great work resulted in the maternal mortality rate dropping from 18% to 2%. So women giving birth, and they weren't washing their hands, and that 18% of mothers died giving birth. So he introduced hand washing to save the lives of birthing mothers. The mortality rate, the death rate, dropped from 18% to 2%. Semmelweis published his findings in his book Etiology, Concept and Prophylaxis of Child Bed Fever in 1861. He was hailed as the saviour of mothers. They murdered him. They killed him in a psychiatric building. That's what the other doctors did, because the doctors said, oh, he doesn't know what he's talking about, and they murdered him. Just, outrageous. Anyway, I can't find that other bit. I'm going to have to find it another time. But I don't know where the hell it is. I went through all these other practices, which I already went through so many of the practices. Here we go, here it is. Okay, the treatment of people erroneously, subjectively labelled mentally ill is fake. I'll have to prove that it's fake. I'll do that in a minute. The treatment of people erroneously, subjectively labelled mentally ill dates back to before the Middle Ages. It was mostly barbaric, violent, resulting in death. Nothing's changed. During ancient times, marriage was considered a cure for women they labelled hysteria. The Greek word for womb is hyster. People were subjectively labelled frenzy, mania, melancholy, fatuity. They outrageously believed the moon caused lunacy. The church wrongly believed sorcery, demon possession, witchcraft were signs of madness. During the 1300s, 1400s, 1500s, 1600s, demonology, exorcism, trephining, aka trepanning and trephination, purgatives, execution, imprisonment, chaining to walls, flogging, locking up in dungeons, left as homeless beggars, the bath of surprise, ice baths, folk superstitions, religious, psychological, astrological, traditional healing remedies were common. The only one that's not violent in that list is the last one. Certain behaviours were attributed to supernatural forces such as possession by the devil or curses of witches and wizards. Music therapy, herbs, diet, acupuncture and other folk and emotional remedies were sometimes used. Trephining was a surgical procedure where a circular piece of bone is drilled and excised from the human skull using an auger, bore or saw to falsely let evil spirits out of the body. The bath of surprise involved dunking people in ice-cold water without warning. Purgatives were laxatives used to induce diarrhea, supposedly to reduce high fever in a person. Exorcism is a religious or spiritual practice of evicting demons, jinns, or other malevolent spiritual entities from a person or an area believed to be possessed. Prayer can cast out demons in people. Jesus and his disciples did that a lot. But what they did in the Middle Ages is they used all these violent practices, and they basically just killed their victims with all these violent practices, Okay, oh, sugar. That doesn't sound good. Sorry about that. Okay, I'm going to prove that, let me just read out the bit where I prove that the words mental illness are fake. It's all fake. It's all bullshit. Okay, we need to examine how psychiatrists and their predecessor death doctors, alienists and surgeons have used subjectively invented, corrupted, manipulated language to create a Holocaust. I will now prove to you their concept mental illness does not exist. It's fake. It's fake, lies, gross defamation, erroneous, fraud, 100% subjective. Also, the word and practice of psychiatry is fraud, fake, and dangerous. The word mental derives from the word mind. The word mind in Hebrew is levav, which means heart. Is the center of human thought and spiritual life, refers to one's mind, thoughts, inner person, will, and understanding of the heart. In Hebrew, mind is also translated moach, meaning brain, intelligence, or marrow, and relates to the word koach, meaning strength, power, or ability. In Hebrew, mind also translates as opinion, view, knowledge, wisdom, insight, soul, psyche, person, spirit, life, conscience, wind, breeze, air, thought, thinking, idea, conception, memory, memorial, remembrance, recollection, reminiscence, intelligence, intellect, reason, brain, wit, heart, conscience, centre, middle, rooster. Remember, recall, keep in mind, bear in mind, collect, recollect, reserve, keep guard, keep an eye on, stay care of, take care of, be careful, beware, look out, watch, pay attention, notice, take care, attend, mark, regret, be sorry, grieve, be afraid, sorrow, resist, oppose, object, be against, rebel, care. The word mind in Greek is translated nous and dianoa, meaning thinking through, thinking over, understanding, seat of understanding, sentiment, reflection, knowing, reasoning, feeling, divine or human in thought, feeling or will, deciding, counsels and purposes of mind, soul, human soul. The word soul in Hebrew is nefesh, also nefesh, neshama, and ruah, and translates as breath, living being, living soul, living human, immortal soul, life, creature, throat, breathing, eating, drinking, himself, herself, mind, appetite, persons, whole person, life force, yourself, the source of good inclination, every fibre of my being, a whole person with consciousness, desires, needs, and emotion. The Greek word for soul is psyche. Psyche, S-P-S-Y-C-H-E or P-S-U-C-H-E or P-S-Y-K-H-E, meaning breath, mind, life force, spirit, physical life of a person. The soul is the seat of attitudes, emotions, feelings, affections, personality, thoughts. The soul regarded as a moral being designed for everlasting life. The soul as an essence which differs from the body and is not dissolved by death. The core of one's life, whole in our soul, understanding a visible and animating principle or entity which occupies and directs the physical body. Latin for psyche is animating spirit, the human spirit or mind. I've only got 2% of power left, so I'm going to get cut off. If I do get cut off, I'll do another video on this chapter. Whether intentional or not, and this is important, whether intentional or not, when people in society say other people are, quote, mentally ill, they are really saying that they want to wipe out, kill people they deem inferior. That's it. From the start to today is defamation and character assassination of humans. So really, if people call you mentally ill, it's a death threat. It's actually a death threat. Okay, I proved it by doing this linguistic analysis of the history of all these words. They're just words that they just make them up. Subjective labels. It's all bullshit. The word psychiatry is derived from the Greek word psyche, meaning mind, soul, spirit, invisible animating entity occupying the physical body. As I have described, the term and practice psychiatry was subjectively invented by German physician Johann Christian Riehl in 1808 and literally means the medical treatment of the soul or psyche. It is literally and biologically impossible to medically treat the soul or psyche. You can't do that. You can't medically treat the soul, especially for a non-existent or subjective reason or opinion of another human being. Before, these so-called doctors who subjectively labelled people as mentally ill were called alienists and their victims called aliens. From the start, they didn't see their victims as human, enabling them to commit their violent atrocities, and this continues today. Before and after the word and practice psychiatry was subjectively invented, doctors, alienists, psychiatrists, surgeons and the public assaulted, tortured and killed their victims for the non-existent and or subjective label of mental illness. The word psyche comes from the Greek word psyche, meaning soul, mind or spirit. We know the word mind in the Hebrew and Greek literally refers to heart, brain and soul. Psychiatry is fraud, fake and dangerous because it's impossible to medically treat the soul, spirit, mind, psyche, heart or brain for a non-existent or subjective reason or opinion. To do so is harmful. It's an attack on the brain. You can assault, torture and kill the brain and heart and try to kill the soul. And that's what throughout history today their treatments practices have done and try to do. You can't kill the soul. It's the divine part of the living human that communes with God and Jesus, or Satan, the devil, 666, in prayer. In today's world, a neurologist treats the brain if there is a biological injury or tumour, for example. A cardiologist treats the heart for similar reasons, yet psychiatrists treat their own subjective labels, not the brain or heart. For many centuries, atheists and other scientists and doctors believe children and adults are animals without a soul, so their treatments are cruel, violent, torturous and dangerous, resulting in death. According to the above semantic analysis, the term mental in mental health is derived from the word mind, which is the brain, heart and soul. A more accurate description is brain health, not mental health. You don't have a mental, do you? You don't have a mental. You have a brain, heart and soul. Humans don't have a mind outside of the brain. It's literally the brain. So when you're talking about organs, we're talking about the brain. That's it. It's just the brain. That's what the mind is. It's the brain. And in terms of organs, I'll read that again. Humans don't have a mind outside of the brain. Absolutely not. It literally is the brain. But psychiatrists don't treat the brain, heart and soul. They treat highly defamatory, subjectively invented labels, just words, not based in human biology or any objective testing. Many Google searches claim mental health is a state of mental well-being that enables people to cope with the stresses of life, realise their abilities, learn well and work well and contribute to their community. This is 100% a subjective sociological definition, not medical or biological. It's more of a survival of the fittest attitude. Google sources claim mental illness is also called mental health disorders, refers to a wide range of mental health conditions, disorders that affect your mood, thinking and behaviour. Once again, this definition is 100% a subjective sociological definition, not medical or based in objective biological reality and testing. Likewise, the term mental disorder is 100% subjective, fake and fraud. The word disorder means confusion. The word confusion is 100% subjective, not biological nor medical. All psychiatrists will admit they cannot explain what causes their subjective, erroneous, made-up concept, mental illness. If you can't explain how a concept exists, how can anyone accept it as fact, truth or reality? Remember, the word mental is derived from the word mind, which is your brain, heart and soul. Humans are 100% entitled to their own thoughts, feelings, emotions, behaviours, views, experiences, imagination emanating from their brain, heart and soul without being subjectively labelled as disorders, diseases or illness. The human brain has great capacity for thinking, imagination, creativity. This is very normal. Human thoughts, feelings, ideas, emotions, experiences, mood, behaviour are 100% normal. To say they're disordered, diseased or ill is a big fat lie, fake, gross defamation, 100% subjective, not based in objective biological reality or testing. and has resulted in some of the worst types of abuses and violence perpetuated on the human race. It's also very important to know that the highly defamatory, fake, malicious, subjective words, labels, mental disorders, mental illness, lunatic, lunacy, crazy, insane, insanity, idiocy, woodness, madness, whack job, nutcase, nutter, nut job, cooker, maniac, asylum, have enabled the world to create